Great, thank you so much, Julie, and welcome to this PQMD Pillar Talk. I am Adele Paterson, CEO of International Health Partners. Today's Pillar Talk on being helpful in your product donations, not harmful, is timely. And I say this is timely, not just because this is PQMD's Guidelines Week this week, but because the last 2 years have seen significant outpourings of product donations in response to the COVID-19 pandemic and the need in Ukraine. My organisation, International Health Partners, was set up after a similar outpouring of generosity following the 2004 Indian Ocean earthquake and tsunami. And as with the war in Ukraine and the COVID-19 pandemic, communities, countries, companies, individuals responded to the need that they saw. But with hindsight, we see that without regulated coordination, supply chain expertise, connections between donor and in-country healthcare workers, and reference to best practice in all these areas, there was a danger then, as there is now, that this well-intended help is not received by those who need it most, and in the worst case scenario, can be harmful. The impact of climate change, conflict, natural disasters means that there will be many more opportunities for generous donors to respond to need and for organisations to receive donated medical product donations. So it's right and timely that we have this discussion now to ensure that we are prepared. And as we will hear from our panellists, the PQMD guidelines, we believe, are the right way of doing medical product donations. They provide practitioners with tools and a supportive community to shape best practice donations for the benefit of the end user. The guidelines do not stand still, and they are ever evolving, building on over 20 years of experience in medical product donations, whilst also reflecting new donation scenarios, evolving products, and improving compliance. If you're new to this space, it's great to have you here, and I would encourage you to engage with the PQMD community of practice. This month, the Guidelines Committee is hosting the Community of Practice Ask the Expert area. If you've got questions following today's session, please visit that part of the PQMD website and you can enter any question on this topic and you will receive expert advice in response. If you're already aware of the guidelines, be encouraged to continue engaging with them, taking your organisation on a journey towards compliance and ever improving adherence to the guidelines, which will shape your donations programme to be helpful to those who need support. Today in this session, we're really lucky to be joined by 3 PQMD members, each a leading expert in their field of product donations. Mohammed Atiye works for ANERA as the Regional Product Officer for Medical Donations, and he'll be providing a recipient perspective on what it's like to be part of a helpful donations programme. Paige Buchanan will present the corporate perspective. She's a Senior Manager in the Global Assistant Patient Programmes and Corporate Social Responsibility at Amgen. And last but not least, Marcia Rader will be wearing 2 hats. First, as the expert senior specialist in strategic philanthropy and gifts in kind at International Medical Corps, and second, as chair of the Donation Guidelines Committee. So enough from me. I hope this is a great session for you all. And to open, we have a really simple question for our panelists. And the first question goes to Marcia. Marcia, can you tell us a little bit about how the PQMD guidelines help you?
This question. Personally, they actually provide the guardrails for managing product donations, right? So whether it's receiving or managing them through the continuum, you know, it's something that I can actually stand behind when I have to explain to partners why we can't accept products that are less than a year expired, you know, from expiry, or when they're coming to us and offering us nearly expired or just expired products. I mean, scenarios like that happen a lot. And especially we saw that more frequently during the Ukraine crisis, when well-intentioned organizations were like, we've got product, let's donate them. So it was something that we were able to share with them to explain why that wasn't a good idea. It also is something that we were able to share with other partners who were maybe looking, were well established, and we're looking for additional ways to support the crises. For instance, we have a long-term partner who is used to donating a lot of pharmaceutical and consumable supplies, but they were going into another sector, right? And looking at about donating equipment. And so that was a new space for them. So we were able to go through the guidelines and explain that, if you're donating the equipment, is it used within the context in the country? Are the materials available in the local language? What about the power supply? Is it compatible? What happens if the products need to be serviced? Is there a pathway for that? So it's not only for new people entering the space, but I think that the guidelines have been really helpful in guiding people who are looking to expand as well. So all these considerations are in the guidelines.
That's great, thank you. I love the idea that it's something to stand alongside, that you don't have to start afresh every time you start a conversation. How about you, Paige? Can you share a little bit about what the PQMD guidelines have done to help you in your role? So Paige, we just need to come off mute. Thank you.
Thank you. Absolutely. Let me just say a few words about Amgen here to start. Amgen is one of the world's leading biotechnology companies. We're a value-based company, deeply rooted in science and innovation to transform new ideas and discoveries into medicines for patients with serious illnesses. At Amgen, our mission is to serve patients. Providing access to our medicines is an extension of this mission. Quality is the cornerstone of these activities and is woven into everything we do. So when we began exploring product donations, we turned to the Partnership for Quality Medical Donations and its members to develop a comprehensive global SOP that aligned to these best practices and quality that we were looking for to ensure our patients around the world had the right medicines. This SOP aligns directly to Amgen's ESG framework and one of our 4 strategic pillars, healthy people. We focus on removing barriers that limit equitable access to healthcare so that people can live their healthiest lives and align to the Sustainable Development Goal number 3, good health and well-being. Since 2018, we have provided more than 900,000 daily doses of Amgen medicines at no cost to underserved patients in more than 20 low and middle income countries through PQMD partner NGOs. In my work at Amgen, the PQM guidelines helped me to develop this standard operating procedure that built confidence with our internal teams, including compliance, quality, regulatory, medical, and law. Ensuring partnership with these internal stakeholders allowed us to compliantly donate commercial grade product to countries where we do not have an Amgen presence or a distributor. Further, today, these guidelines help me and my team to respond internally to individuals who may not be as familiar with the history of medical donations. We frequently refer our internal teams to the guidelines as a starting point for internal conversations and to educate others as to the importance of a global standard written and certified by our peers and the NGOs we seek to support. That partnership between the corporate members and the NGOs is really the catalyst for us being able to compliantly donate. And if both of us are not speaking the same PQMD guidelines, then we are not able to donate. And so it's really lovely to be able to come to a place where all of us want to do the right thing and we're all following the same guideline. And therefore we know that we can trust our partners to get high quality medicines to our patients, no matter where it is in the world. And with that, I'll turn it back over to you, Adele.
Paige, that's excellent. Thank you. Amazing to think in so many different scenarios. You have a starting point. I think you talk about it, that you can manage that conversation internally for some of your colleagues who might be more risk aware and risk averse, that you can answer lots and lots of questions. But the fact that you see the guidelines as a starting point is a wonderful resource for you to have, and also be part of that community that is the corporates and also the NGOs. Thank you, Paige, for sharing that. Mohammed, you have a unique experience within this group of people. You are a recipient organisation that receives product donations from a number of PQMD partners who are adherent to the guidelines. So it'd be great to hear from you how the guidelines have helped you in your role at Anera.
Well, thank you so much, Adele. Good evening, everyone. One of the challenges that the medical donations program faced during the past was the absence of a clear guidelines for gift in-kind donations globally. And BQMD guidelines came to fill that gap and to standardize and guide at least members of BQMD to unify into these guidelines. In return, we learned from these guidelines and we reflected that experience on our beneficiaries and on our recipients. For example, we guided our recipients on how to assess their needs from the offers that we are receiving from our donors, and how to assess their needs, especially during the emergencies. This helped us as a medical donations to reply fast to our donors, guiding us through the shortest way to deliver our services and to achieve our goals of helping vulnerable communities. As an example of an important area where we followed the guidelines, we made sure that the medical donations that we are importing in the country are needed, first of all, and secondly, we made sure that these medical gift in-kind donations are usable by our recipients. Other than that, we will find ourselves with the huge quantities of donated medical supplies that needs to be recalled or destroyed, and that will add an extra load on our recipients. So what we did is that we trained our team on BQMD guidelines, which helped us develop a very clear standard operating procedures for all our teams, regardless of which country, to unify our work. And that reflected on us as a medical donation program, in addition to reflected on our recipients themselves. As an indicator of how efficiently we delivered our services, almost none of the donated medications were destroyed by our recipients due to being expired. And about 99% of what we distributed were dispensed and benefited the patients in the area where we serve. On another point, the shortage of the staff and the high turnover within the team is a challenge that PQMD helped us in by providing a newly joined staff with a unified guidelines to be used as a training materials and as a reference to them in order to understand the cycle of our work as a medical donation program, and to understand it in a fast manner and in an efficient way. So that's it from my side, Adele, and I'm glad to answer any of the attendees' questions, of course. Thank you.
Thanks, Mohammed. Well, it seems like the guidelines have been extremely helpful to you as a recipient in country. I don't know if the guidelines committee were aware that it's part of the induction program for staff at Anera. So really great to hear that the journey that the Anera staff are on straight away in order to be compliant. And then we saw a really good statistic there that as a result of adherence to the guidelines, 99% of the products that are donated are distributed, which is a fantastic outcome. And I'm sure there's been a great improvement since that has been the case with the adoption of the PQMD guidelines. So thank you for sharing that, Mohammed. And I love the idea that actually the guidelines fill the gap. And I'm guessing people who are starting on a donations program may really fill that gap, whether they are a company or a receiving organization, and great to hear that that fills the gap. So Marcia, back to you as the chair of the guidelines committee, and so you've got to put your other hat on now, just not the IMC hat. Can you tell us a little bit about how the guidelines developed, and also any changes that you're beginning to see as well?
Absolutely. I think just to start with, I think it's important to understand that, you know, I personally remember back in the 90s, right, the late 90s, product donations, especially, you know, GIK was kind of had a bad name. It was looked at as a dumping ground for unwanted, nearly expired or expired products. And so the majority of that really, you know, wound up in landfills or, you know, had to be destroyed. But the worst part about all that is that, you know, some of those products could have wound up in the hands of patients, you know, putting their lives at risk. And in recognition of that, back in '99, you know, a small group of American manufacturers and organizations realized the importance of joining forces to come up and develop a set of criteria and guidelines and standards to really reflect that best practices for the program, so that we really could address, you know, the global health community. And it's so funny because you would think of the corporations and, you know, in a normal sense would think of themselves as competitors, right? But recognizing this was a much bigger challenge and problem that needed to be solved, that came together as a collective community along with the nonprofit organizations to develop this standard. And now it's what, 20 years later, more than 20 years later. And I really believe that the guidelines are considered the industry standard for best practices. And they've been adopted by, you know, some of the top pharmaceutical, medical supply, and equipment companies in the world, as well as nonprofits. And, you know, they really we want to ensure that we're hitting the target and really reaching out and providing equitable access to medical donations, right? And my favorite part about it is that it does evolve annually, right? It's not a static document. Each year we come together as a group and we reevaluate the guidelines, looking at the latest trends and things that we're experiencing, and then really shifting and adding those components to the guidelines. Really good example of this would be during COVID-19, right? As an industry, we saw an influx of counterfeit products hitting the market. So how do we address that and provide some framework around recommendations? Because they're not, you must adhere kind of type thing. It's recommendations to how to mitigate those risks. So for our organization at International Medical Corps, despite being a heavily compliant organization with measures in place to really kind of ensure that the quality of the products we're getting are exceptional and meet the standards, we wound up with a counterfeit product. But we were able to quickly respond, but we had to add some additional layers into our program so that FDA certification, FDA certs and test reports needed to be provided. And then we hired a third-party evaluator to ensure that we were, that they were authenticated. So some of those for that framework was added to the guidelines. And that's just one example of how we evolved to make sure we're meeting, you know, the ever-evolving industry.
Fantastic, thank you. And I think we can look back on the last 20 years and see the progress, but I think what's so important with this annual review is that we're not resting on our laurels as a sector. We continue to see the new trends, and maybe we'll hear a little bit later about some of the other trends that you might be observing on the committee. So thank you for that, Marcia. Paige, from the corporate perspective, what would you feel are the big issues that corporates are facing as they decide how they're going to create a gifts in kind program? What might be some of the challenges a corporate would face in that process?
I actually have a few examples, so I think I'll start with chronic medications in the gift in kind environment. So a lot of the donations that we make are to countries where Amgen has no presence and no distributor. So they're going through our fabulous NGOs, our PQMD partners who are qualified. And the challenge is making sure that the medicine from the first day the patient receives it through the very end dose, that they have continuity of care. So the first thing that we do, and one of our principles, we've set up a set of principles for gift in kind giving to help mitigate some of these risks, is you must be able to say, I can give it to this many patients for the duration of their therapy. And so that narrows the amount of product that we give in some cases, because a lot of times that would have to be acute therapy. In fact, principle number 2 of our guiding principles for donations of Amgen medicines is the product is a chronic therapy, so we can donate chronic therapy medications, but only where we make a long-term agreement to continue providing the product to that patient, as long as that physician believes that it's the right thing for that patient to be on that medication. And that brings with it the challenges internally of the financial donations, because Amgen also has another principle where we only provide medications if we can also provide an administrative donation that covers the cost of any recalled product, any product that has to be destroyed. It covers the NGO being able to track that product all the way to administration to a patient, ensuring that we don't have any diversion. So those guiding principles have been very helpful to us, and it's a living document. That those guiding principles have gotten bigger as we've grown as a team in access to medicines and how we do things. You know, some of the other challenges that we've built into the principles have included in recent years that the dosage form has an alternative if you're providing a medical device. So if that medical device fails, you must have an alternative to give to that patient, which also then makes us think very hard about where is the patient in their journey? Are they able to come back to that hospital? Because many times we're providing treatment to patients in rural areas and they are not able to come back. Also, are we using all of our resources? Many of us as corporates have subsidiaries, and we have other parts of the business that also have different medications and medical devices and even medical equipment available to us. Are we thinking holistically about what can we provide? Is there a whole basket of medicines versus just, oh, let's donate this one medicine? So getting out of a more siloed approach to having greater discussions with your NGO about how can we provide comprehensive care, not just starting at let's donate a medicine, but looking all the way back to, is the lab equipment appropriate in order to test the patient, for example, for HER2 positive breast cancer? Does that equipment give us the appropriate reading for an appropriate diagnosis? And if not, how are we supporting those hospitals and NGOs at the point of care, and not just at the medicine, but also looking at the entire continuum of care for that patient? So there are so many challenges. I could probably talk all day about the different challenges that we have looking at how to serve Amgen's mission, which is to serve patients and get them the appropriate access, and just being able to partner with PQMD member representatives who are also looking at the guidelines and also thinking in that same mission-oriented way has helped us to have very effective donations, like Muhammad said, you know, where very little gets destroyed and patients get the help that they need.
Thank you, Paige. I think it was Marcia that said earlier on that it's a non-competitive space. And it's fantastic to hear that, you know, you have a community page when you're thinking about this really complicated set of questions around chronic diseases or complex diseases that require not just the medicines, but time and equipment, how you are going to respond with a basket of help. And that's a really thoughtful response. And I know that you know, there's lots and lots of questions to ask you around that, but that's a really interesting summary. So thank you for that. Mohammed, it'd be great to hear from you again about your in-country experience. Obviously, a whole range of different scenarios that you experience at Anera. It'd be great to hear how you find helpful medical product donations look like. What does a helpful medical product donations look like for you compared to a harmful one? You touched a little bit earlier on about things being in date. Maybe you could tell us a little bit more about, you know, the practicalities of a good product donations program.
Sure, Adele. So for me, first of all, a medical donations program that has a sustainable distribution of the most needed medication by the healthcare facilities recipients, especially when it comes to oncology medications and other chronic medications like antihypertensives and anti-diabetics medications, where the patients cannot afford to buy them from the regular pharmacies, and in most cases they are not available at the MOH clinics. So this is number one. Number two, I think the medical donations program that knows the needs of their recipients. To be honest, this is very important. Very important. Otherwise, as I said, importing these donations might exceed the needs or might not be usable. And this will add extra workload on the program itself and the recipient staff, where these donations will be need to be recalled or destroyed, as I said previously. On the third point, I think a medical donations program with a very clear structure to guide the healthcare facilities from side and the donor from the other side. This will help save the time from the moment when the medical donations team receives the offer to when the shipment arrives and gets fully distributed. This means saving more on the expiration date of the donated medicines, which allows to accept and deliver more quantities of the offered items, and to fill the gap again between what is needed and what is offered by the donors. Moreover, the unclear structure of the program, managers of the program will find it hard to identify the strengths and the weaknesses of the program to readjust and reassign the duties and the responsibilities of, for their team members to deliver at the level that they are expecting. So yeah, and for me, I think a medical donation program that understands the authorities' rules and requirements. To be honest, this is very important, especially for us where we serve in an area where we need to obtain approvals for our shipments. And because of the political situation here, any missing requirement will end up with us, will end up with the shipment being delayed or declined by the authorities. The other point, the final point, let's say, is with the technological revolution, especially after the COVID-19 pandemic, where most organizations virtualized their work using the available tools and utilizing these tools to analyze and track the workflow is a helpful environment for all the involved parties, whether the medical donations program itself or our recipients or the donor, rather than relying on the field staff to manually collect this information. These tools should reduce the load on them and will deliver more accurate results to the program and the donors. So for me, I think in general, these are the most important points that each medical donations program should have and should follow in order to deliver their services in an accurate way. and to not add a load on the shoulders of the recipients, because we know that one of the main challenges that in the low income countries, most of our recipients are suffering from the shortage of the staff. This is very obvious to us, at least in the area. So we are trying to use the technology in order to make the technology and the tools works instead of the staff doing that manually.
Thank you, Mohammed. Really great summary there. Know the needs, be organized, have a clear structure, communicate, know the regulations. So the same things that we needed 20 years ago: regulated coordination, supply chain expertise, connections between the donor and the in-country health workers, and reference to best practice. It's the same things, and of course the technology is evolving. So great, Mohammed, that you gave us that challenge as well, to use the technology so that the burden doesn't fall on the recipients. So helpful, thank you. In a minute, we're going to have some time for some questions. So if you have any questions to ask our panelists today, do put them in the chat. It'd be great to hear from you. I'm sure there are many people on who have questions. But another quick round robin, and I'm going to start with Mohammed on this one before we head into the time of open questions. If there's one thing you would like the audience to take away today, Mohammed, what would it be? One simple takeaway from our time together, what would it be?
It would be focusing on the field. Yani my message to the medical donations partners and the donors, the field visits to the recipients themselves is the way to measure our impact and to feel satisfied of being helpful to our people, to be honest, because any report or any email will never be able to describe the kind of help you provided these people with, rather than hearing these stories from the field. So yeah, I would like to focus on the field, the site visits, and PQMD guidelines are also covering these areas as well. So please make sure to revisit the guidelines from while to while, because it will make it smoother for you to do your work, and it will be the shortest way to deliver your goals and your services.
Trust the local experts, Mohammed.
Thank you so much, Adele.
How about you, Paige? What would you like people to take away today?
That PQMD is a safe place for you to learn from your peers. That has been absolutely invaluable resource. Just being able to use the community of practice to ping one of my peers and say, hey, we're having this, experience. What have you done in that experience? And the willingness of peers to share their experiences and to help you to become better in your work is absolutely amazing. And then encouraging everyone to develop those relationships with other organizations to better serve patients around the world. If we don't reach out to our peers and find out what is needed and learn about those programs and have those conversations, then we're not as effective in serving the patients who need it the most. And don't just talk to maybe your NGO partner, but if they're also partnering with another NGO as well, bring all three of them onto the phone and have that conversation together. It just makes such a difference when you build a program from beginning to end.
Thank you so much, Paige. Marcia, before we hear from you, I just wanted to highlight some of the things going on in the chat at the moment. A point was made earlier on by Paige around measuring impact. And as Julie mentioned at the beginning of the talk, there are a number of different activities that PQMD is involved with, one of which is around measuring for success toolkit. And there's been a reference included there to some more information about how you might think about putting together a monitoring and evaluation program, an impact measurement program, and also the reference to the community of practice has also been pasted as well. So if you get the chance, have a look afterwards and see the resources that are online. There's some great stories and also lists of all the other members as well. Marcia, what would you like us to take away from today?
I was actually just going to reference a lot of those materials, but I guess
Marcia,
Yes.
It's Kim. Can I pose a question to you to get you talking about something you can leave for everybody?
Sure.
How can I learn more about the PQMD guidelines?
That was where I was just about to start. Thank you, Kim. So yes, the PQMD guidelines are available obviously on the PQMD website at pqmd.org. But we also partner with another wonderful organization called disasterready.org, where we actually developed and created a module so that you can take you and walk you through the guidelines in bite-sized pieces. And at the end of that, it also gives you an opportunity to do a self-certification. So kind of an assessment on how you are currently performing against the guidelines themselves. And there's an opportunity in there also to say, this is an area that maybe I could use a little bit more help on. And that's the thing about PQMD and the community of practice and all the folks that are member organizations is that, the guidelines are available for everybody. And all of us member organizations and companies, we're all here to help. And so we encourage everybody to just ask. We mentioned the COP or community of practice earlier and the ask the expert. Please don't be shy. There are no stupid questions. There are no dumb questions out there. It's like, you'd be surprised, like even some of the top corporations who are looking at new avenues of donations don't know it all either. So the great thing about PQMD is we do have a collective input and knowledge base from across the sector, whether you're a corporation or you're a nonprofit organization. So we're here to help. We're a friendly bunch. So does that answer the question, Kim?
Thank you, Kim. great to hear from you. And also great to hear from Dasha from International Rescue Committee, one of our newer members, echoing what Mohammed was saying about local expertise, that it's really crucial in ensuring a good donations program. So it's great to have your expert voice here today, Mohammed. Thank you. We also had a question from Andrea, who is new to PQMD. So really great to have you as part of this call, Andrea. And I'm going to put this to the chair of the PQMD Guidelines Committee, but I'm sure others might have a view as well. Andrea was saying, I was just wondering about the World Health Organization guidelines for medicine donation last reviewed in 2010. How do the PQMD guidelines branch off, reference, utilize this? I mean, anyone can jump in, but I thought Marcia would be a great place to start.
It's a great question. And we are in complete alignment with the WHO guidelines. And actually some other members who may have been around longer might have additional information on that. But our guidelines are reflected and completely in alignment with the WHO guidelines. Additionally, as you noted earlier that, from 2010, a lot has changed within our industry. And that's one of the great things about the guidelines that we have at PQMD is that they're not static. They are constantly evolving. And it's the collective input and experiences of all the organizations and companies that kind of influence the changes that are reflected in there.
And certainly EJ, who is PQMD's executive director, one of her roles is to be very outward facing, to make the alliances and connections to ensure that we aren't just working in a PQMD bubble, but we are connecting with all the other people who are in this space as well. So parts of the conversations that are going in and the multinationals. And I think it's great today that we probably also got some colleagues in the space who've joined us from DevEx, and that's kind of testimony to the outward-looking approach that PQMD is having in trying to collaborate in bringing about the best for the end user. So we're always into collaboration and always want to hear from new people. So thanks so much for that, Marcia. Steve, one of our members, and I think a lot of probably NGOs' ears were opened up when Paige, you mentioned not only the combination of thoughtful product donations, but also cash donations to support the gifts in kind distribution and monitoring and evaluation. Are you able to share a little bit about the principles around that and how that works out at Amgen?
Absolutely. So we look at a donation not just as product. It's easy to take cans of food to a food bank and give them to the food bank, But what people don't think about when they do that is the food bank, if they had gotten cash, probably could have bought double that amount of food to distribute, because now they have to hire someone to sort the cans and to make sure that none of them are dented, and the only product that's actually viable gets to the recipients. So we look at it in that same way, that we're not giving you a donation of medicine and thinking there is no cost for you to now ship it halfway across the world to some places that are sometimes very remote, and having to go through customs, having to ensure that product is not diverted, to ensure that that product is then refrigerated appropriately. And that is, again, one of our principles, that all Amgen product that is donated can be appropriately stored from the time it leaves Amgen all the way through the time that it is given to a patient. And that has an administrative cost. And so part of our principles are that we support those administrative costs for the NGO who is helping us to get that medicines to patients who need them.
And that's often an interesting part of the discussion. I'm sure Marcia will agree. When you start to talk to people, and certainly perhaps it doesn't happen as much as it used to happen, but you start to explain, you're a compliant organisation, so International Health Partners is regulated by the Medicines Healthcare Regulatory Authority, which means we have to adhere to good distribution practice, which requires us to pay for somebody to be fully qualified and also train the whole team. These things cost money, and it's an expectation, of course, that we would be in that space. But we appreciate it when companies recognize there are costs involved in taking and distributing their product to the best practice as well, and in keeping to guidelines. So thank you for that. And I know that many of the PQMD members on the corporate side also share that commitment as well to those operating costs. So thanks for sharing some of that. Victoria, our faithful PQMD helper, have you got any other questions that are popping up that you can see?
I do. I'm actually getting a bunch of messages sent directly to me, so apologies. I will read one that actually just came in. It said, actually, one of the things that does immediately come to mind is if there's an opportunity to use the incredible network and experts in PQMD, especially thinking of the NGO side, to generate lists of drugs, medical donations that are needed during a time of emergency. This generally can take longer to assess, and I wonder if there's a way to lean on each other. We may not all have the same needs, but at least sharing across the orgs could be helpful to streamline final lists for each organization. We could then proactively share these with corporate partners and members who are looking to make donations.
Do you mind if I jump in on that? I think that's a great idea. So during an active emergency, it's a very unique space, right? Whether it's an immediate onset or natural or man-made disasters. And I'm sorry, Adele, I'm going to call you out and for IHP and also HPIC. There's some organizations that actually develop kits that are ready to deploy at a moment's notice, and they typically include, the essential drugs, and they've been really developed with this mindset of during an immediate onset, what kind of emergency, what type of things are going to be needed while assessments are ongoing, so that our teams can hit the ground running really quickly and get up to speed. So some people may be familiar with the IEHK kit, so the interagency, the WHO kit, which is much larger. Well, International Health Partners has a kit called the Essential Health Pack. And I'll be honest, we as International Medical Corps utilize those so frequently during an immediate onset because they're ready to go and they have the essential drugs that our teams need immediately while the assessments are taking place. HPIC also has theirs, humanitarian medical kits. And I know there's other organizations that develop these. That's usually our first go-to in the immediate onset while those assessments are going on. But I do think that a lot of us do collaborate with our needs lists, that as those assessments come in, that we are then sharing with our partners. So, the collaborative nature of our work, I think, is integral to our abilities to be able to deliver our services. So I hope that answered that question.
Yeah, and in the event of a disaster, there is a call and a group of people get together from PQMD, from the member organisations, and have conversations and talk about the scenarios that they're experiencing, what their in-country partners are experiencing, or their colleagues, and really share real-time information about what's going on and what's needed. And that's another great value add, I think, for the members as well.
Adele, this is Pat. I have a question. I don't even know if it's a question, but maybe it's an opportunity to hear from some other folks. Marcia and I spoke probably last week, and we were talking. She talked earlier about counterfeit, and I received a call from a few people asking for product and even expired product, which was pretty shocking to me for Ukraine. And I guess my question is anyone else still receiving those types of inquiries? And also, how do we reach a broader audience so that we can share the guidelines? I mean, it was pretty disconcerting. And I'm just curious if anybody else is still experiencing that. Oh, I forgot to turn my video on, sorry.
Well, great to hear from you, Pat. Thank you. Anybody want to share that? Or even, I think, to the point of who else needs to hear the key messages that we've heard today from Mohammed and from Paige and from Marcia about best practice? Who do we as an organisation need to get speaking to?
Well, it's interesting because the conversation that Pat and I had earlier this week was about that, because I'm still receiving those calls. You know what I mean? As I mentioned earlier, like somebody calling and saying they're only nearly expired. Like, wait a minute, my litmus, would you give that to your child or your, your family member? It's not okay. And so I think the only way we can get it out there is by sharing the messaging. We have a guidelines at a glance document that we created that we really hope that everybody else share broadly. And if there's other networks that we should be speaking at and talking to, I really encourage anybody on this call to share within their networks as well, because we really do need to squash this kind of messaging. If it's not okay for you and your family, it's certainly not okay for anybody else.
And it's still happening, which is unfortunate. And there just has to be, maybe we're just missing something, and we're not really looking at every opportunity or every avenue to get these guidelines out there, but there's still a big need for them. And can I just mention one other thing? Because I know we talked about the guidelines and PQMD and WHO. And so I was around 20 years ago when we were putting the guidelines together initially. And for those that are not familiar, is that PQMD was very involved with the WHO guidelines, the first set that was done, because they were not very cordial or friendly to the corporate sector. And so it was important that we had key corporates and key NGOs back then, 20 years ago, as we were incorporating, that worked along, well, maybe not worked along with, but provided quite a bit of input to those original guidelines. And so, PQMD then after that, because it was not very friendly to the NGOs and the corporates in the United States, that's when we started to decide and figure out that we needed to put some guidelines together. And that's how it ended up starting to where they are now, which they're fabulous.
Thank you. Yeah, as I mentioned earlier on, a good amount of experience within the organisation. We've all been on a journey, and going right back to the beginning of this talk, we've all been in a situation of what can we do? And we know that feeling, don't we, of this is too terrible to contemplate, what can my response be? And I'm sure we've all had a number of these sorts of conversations, not just this year with Ukraine, not just 2 years ago with COVID, but continually, and we can kind of continue having these conversations that people are going to want to respond, but we need to keep on talking about best practice, and we're all on a journey here. So thank you so much to everybody on the panel for what you've been sharing. There will be a recording of the Pillar Talk today. It's going to be posted, and there's lots of other things for you to be doing on the Community of Practice website. And as Paige said, as Marcia said, as Mohammed said, we're here, we're about collaboration, we're about best practice, and we'd love to just keep on having these conversations. So we really thank you for coming along today. This is a positive conversation. This is about tapping the best of everyone for the best of the people at the end. And I think if there's one thing I could take home today is just focus on the recipients and believe it when they tell you what they need. So thank you to Mohammed, thank you to Marcia, and thank you to Paige. And I will hand back now to Julie for our final comments.
Adele, thank you for leading such an informative discussion. And Marcia, Mohammed, Paige, I love such real life examples. I hope that everyone on the call found this really practical, informative, and I just want to echo what you've all said about the network and reaching out. I was going through all of the participants on the call today, and we have so many new members, both PQMD members and then organizations that are not yet members. And it's super exciting to see you all here participating, asking incredible questions. And hopefully this is the beginning of a conversation that continues. Marcia, just shout out to you for chairing the guidelines committee and driving all of the activities this week. We really appreciate it. And thank you everyone for joining. It's the end of this call, but make sure that you check back, participate in the community of practice, and look for events that are yet to come. Have a great day and stay healthy.
Thank you, Julie.
Thank you, everyone.
Bye.